Namaste everyone. Today I am talking about the cholesteatoma. It is an important topic in MBBS in defined layer. Let's talk about what are the important concept inside cholesteatoma. Definition wise of cholesteatoma is a keratinized squamous epithelium lesion in the middle ear or mastoid capable of expansion and bone erosion. See here. Okay, what are the important topics here? This is the keratinized squamous epithelial lesion. This is occur in the middle ear or mastoid. It has a capable of expansion of the bone, expansion, it occurs the bone erosion. Okay, if you include this kind of ode here, there are so many ode which is given by the cholesteatoma is a keratinized squamous epithelial lesion occur in the middle ear or mastoid bone. It has a eroding property and has a capable expansion. You include this much in the definition. That's okay. There are two type of cholesteatoma. One congenital, which is arise from the behind an intact tympanic membrane. Calamis gave the criteria. What is congenital cholesteatoma? You have to come with one. There is an intact tympanic membrane. Two, there is no discharge. Whitish mass behind the tympanic membrane. Okay, acquired cholesteatoma may be primary acquired or secondary acquired. One, primary acquired to secondary acquired. Next issue is common site. This is the pars flaccida. This is the attic region, which is the most common site of cholesteatoma. What is the pathogenesis? Estrogen dysfunction that create the negative pressure which develop the retraction pocket. There is accumulation of keratin debris that cause enzymatic bone resorption that develop cholesteatoma. Yes, there are different theories. Negative pressure theory is due to estrogen dysfunction. Other four theory are there, like SAID theory, which is given, and other two theory you have to know. Please come with that also. Clinical feature wise, there is a foul smelling, purulent air discharge, and which is so much foul smelling. If a patient come in the OPD, there is a foul smell around the room. Then recognize this is the foul smelling. Examiner can ask, how can you know that you have this patient has the cholesteatoma? Then you have to tell, yes, some patient come in the room, that time maybe foul smelling, smell come around the room. Conductive bearing loss occur the such patient. There is a retraction pocket we can see, which is also called attic crust. We can see the otoscopy or autoendoscopy. Some people describe some facial weakness or vertigo. Investigation first, you have to do, yes, otoscopy. This is the, I didn't tell this is the investigation. This is what we have to call, this is the examination. Okay. What is this one? Examination. Microscopy is investigation. It should come with, if you otoscopy, this is the examination finding, microscopy, it is the investigation finding. Otoscopic, endoscopy, endoscopy is investigation. Make clear concept. Examiner can ask what is, if you do the microscopy, examination under microscope, then this is investigation. And what is the UM? Examination under microscope. You can see the cholesteatoma in this picture. Let's say these are all the cholesteatoma white flaky. You can see here, this is the flaky, all whitish cholesteatoma. You can see almost eroded all the area cholesteatoma you can see. HRCT temporal bone, we can see bone erosion and extent of the disease. What you see? Bone erosion and extent of disease. This is the CT scan. Okay, you can see this is the cholesteatoma here. This kind of cholesteatoma is exposing this area. All cholesteatoma you can see. Uh, this cholesteatoma, this is blackish. Okay, audiometry will help to determine the type and degree of hearing loss. What are the complications can develop after cholesteatoma? That is a vesicular erosion. Incus, you should come with the incus. Okay, incus is the most common airborne which can erode it. There is a facial nerve palsy. Some patient develop labyrinthine fistula and yes, complication you can see intracranial complication of them, meningitis and brain abscess are common. Okay, some may examining and tell there is extradural abscess. Yes, but you have to come with these two, meningitis and brain abscess. Brain abscess, where the brain abscess, you have to come with the two area. Yes, parietal lobe in adult and almost cerebellum in children. This two area is commonest site of brain abscess. What is the main step, the treatment? Don't come with I will give some ointment or ear off. These are the conservative treatment. No use. So you have to come with the exam with modified radical mastectomy. And what type of operation this one? This is the canal wall down surgery. Some examining, some student telling that there is tympanoplasty, but yes, you should come with the modified radical mastectomy. Please tell if you there is a police now, what is the surgery, what is the treatment, then take just answer like modified radical mastectomy. What type of surgery this one? Canal wall down surgery. You can see the cholesteatoma here, all the grafting material kept here. This is the cholesteatoma. You can see here also. There is a canal wall of mastectomy, but there you have to do tympanoplasty too. Okay, canal wall, if you tell the canal wall this is little okay, but I am more happy with if you send just answer with modified radical mastectomy canal wall down surgery in cholesteatoma by undergraduate level. Yes, postgraduate you can tell canal wall of mastectomy and advantage, disadvantage of the canal wall down and of mastectomy and tympanoplasty, and that's okay. But in undergrad level, you have to come with this modified radical mastectomy. Aim of this kind of surgery, remove the disease. First, you have to remove disease and make ear dry and say, what is the aim of surgery? They are asking, just first remove the disease and make ear safe and dry. And next, yes, restore hearing also you mentioned, but if you did first restore hearing, that is not okay. You have to come with a remove disease, make ear safe and dry. So key point, most common site of cholesteatoma, pars flaccida, other area posterior superior quadrant, posterior superior quadrant, most common ossical eroded incus. What is the best investigation here to see the disease and extent of disease? It's temporal bone, surgery choice, modified radical mastectomy. I think I include all the main key point here in the cholesteatoma viva. Thank you for the today's session.